Good morning, Ms. Smith. This is Dr. Jones from the Wellness Clinic. Yes, how are you? Great. I'm calling about your results from your bone density scan that we did last week. Yes, ma'am. We would like you to come into the office. If possible today, there's an opening because we are showing further signs of osteoporosis from the results. So could you come by today at 1 o'clock? Okay. See you then.
Hello. How are you doing today?
I'm great.
My name is Nicole. I'm going to be your nurse.
I'm
Nice to
Smith.
meet you.
This is my daughter, Becky.
Hi, Becky. Nice to meet you.
Nice to meet you.
All right, so I was talking to Dr. Jones about your diagnosis, and so her and I were talking a little bit more about what was important to come in and talk to you about. We want to make sure that you understand osteoporosis. We want to make sure you understand the lifestyle factors that you can change in order to slow the progression of the disease, and just make sure you're really well equipped. You have all the tools in your toolbox that you need to basically get a handle on this diagnosis and how to change your lifestyle to make sure it doesn't progress any further.
Well, the doctor just left, and I'm really not clear on what osteoporosis really is.
Okay.
Like, I know that I can break bones really easy,
Yes.
but other than that, I don't really understand this.
No, okay, and so you have no background really what osteoporosis is or any knowledge
No.
of what you can do for it. Okay, well that's what I'm here for. Well, awesome. You know what, I do want to start off by giving you this pamphlet here. It is a patient education pamphlet, and it'll teach you a little bit more about what osteoporosis is, what risk factors there are, different treatment options. And so osteoporosis is a progressive disease. It does cause the thinning of your bones, and so they do become more porous and brittle over time. So it does put you at risk for injury. Okay, so the first thing I want to talk to you about today is the medication that Dr. Jones prescribed to you, and that is called Boniva. Have you ever heard of Boniva before?
I saw the commercial.
You did?
That's all that I know.
Okay. Okay, no, that's fine. At least you've seen it. You've been exposed to it a little bit. So basically, Boniva is a bisphosphonate. It's an anti-osteoporotic medication. So basically, it helps to prevent or treat osteoporosis in postmenopausal women, which I know you are postmenopausal. So it's a perfect medication to help slow that progression, to make sure that your bones don't become more weak than they already are. There are some things that you need to know about that medication that are really important. The first thing is that you're going to be taking 150 milligrams in the morning. It's only once per month. Something really big to make sure to know about this medication is that you're going to drink it with plain water only. You don't want to, I know a lot of times people will drink medications with things like milk or something that helps coat the stomach. That'll actually decrease absorption of this medication, so you really want to make sure you just drink it with a glass of water. Another really important thing about this medication is you have to take it first thing in the morning, about an hour before any food or drink, and you have to remain upright for at least an hour after taking it. Some main side effects that I wanted to talk about with Boniva, a lot of people will experience dizziness, fatigue, insomnia, sometimes some GI upset. So one of the big things we had talked about earlier was that risk of harm. And so we want to make sure that if you are experiencing any of those symptoms, don't try to get up on your own. We are going to go over today a little bit more about safety, and we do actually have some ways to help you, get around a little easier, and we'll talk about that a little bit later. But it is something to make sure with this medication that if you are feeling dizzy or nauseous or you're fatigued at all, don't try to get up on your own because you are at that higher risk of injury with osteoporosis. One of the biggest things too with this medication is it can cause something that's called osteonecrosis.
What is that?
Okay, so yeah, osteonecrosis is basically the death of tissue in a certain part of the bones. And so in this case, the biggest thing is osteonecrosis of the jaw. So we really want to make sure that you're looking for any signs and symptoms of any infection in your gums. That's the big thing. Any loose teeth, any redness, swelling, inflammation. You really want to report those signs to your doctor. Call Dr. Jones right away if those things are happening. Any pain in your jaw, any swelling, anything going on with your jaw, you call us right away so we can make sure we take a look at it to make sure that's not going on. The other thing too is we're going to start you on some calcium and vitamin D supplements. Those are really important with osteoporosis because calcium and vitamin D work together to help build strong bones. I know people have been saying that since we were children, drink milk for those strong bones, for that calcium and vitamin D, but it is true, we really want to make sure that you stay up with that. The reason why we do the supplementation is sometimes people don't get enough of those vitamins in their diet, so we really want to make sure you're getting enough to help work with that Boniva so it's helping slow that progression. Do you have any questions about the medications or the supplements for me?
No, I think you covered
Okay,
everything.
perfect. And I will make sure too that we give you all of this information written down as well. I know you're a school teacher, so we'll give you some homework and we'll give you some handouts that you guys can look over when you get home too. That'll help you in case you forget anything we talk about
Thank
today.
you, because sometimes it's hard remembering everything that was said.
I'm sure. So yeah, we'll give you all the information that you need, and then we're always a phone call away too if you ever need anything.
Thank you.
Yes.
Okay, so the next thing I wanted to talk about, we touched a little bit with the medications, with that calcium and vitamin D supplements, that a lot of people can't get that with their food. So we're going to have you taking those supplements, but we really wanted to cover some foods that you can eat that will help increase that calcium and vitamin D. Some modifiable risk factors are your eating habits, so we really want to focus on those sorts of things to make sure you're getting as much as you possibly can.
Good, because I know that she doesn't really have a taste for milk, so
Okay.
we wanted to know some alternatives that she could
Okay.
eat to help with that.
That's fine, yeah, we can definitely help you out with that. So tell me, do you drink a lot of caffeine or carbonated
I do
drinks?
love coffee.
You
I
do?
love coffee, but I'll have to cut back.
Okay, perfect. I was just going to say one of the biggest things is we want to make sure we limit caffeine and carbonated drinks, so that is really big. Any alcohol consumption, we do want to limit that as well. So, you know, if you still want to enjoy a glass of wine every now and then, that is okay, but we really want to make sure we cut it down as much as possible. Your calcium, we really want to have about 1,200 milligrams a day of calcium. That's really the level that we want to hit. And so some of the foods that I have here, if you don't like milk, we could do things like yogurt or cheese, fortified foods and juices. You know, if you want to take your calcium supplements with orange juice, that really helps.
And fortified foods, what is that exactly?
Those are going to be more like your cereals that are very high. You know, you want to check those labels on the boxes to see what those calcium limits are. Even keeping a journal with you throughout the day, so you can kind of start to calculate how much you've eaten, you know, and you can see on those nutrition labels, okay, the cereal is going to give me so much calcium. How much more do you need to kind of plan your day out how you're eating? Some calcium-rich vegetables that you might want to pick up from the grocery store, things like collard greens, broccoli rabe, turnip greens, kale. You know, those green leafy vegetables are really good, full of calcium. Okra, broccoli, all really good sources. Okay, so we've mentioned previously that you are more at risk for falls and injuries such as fractures because of osteoporosis. So I wanted to go over a couple little things that you could do in your home to prevent those falls. A couple things include making sure that there are no throw rugs on the floor. We like to say throw rugs, throw people. So you remember that, so it'll really help you. Some other things are making sure that, you know, you don't have any wax on the floor. You know, if you do have bare floors, not to use wax to clean them. I know that we had mentioned previously you are having some issues getting around, some mobility issues. You know, you've been using furniture and things like that. So we do actually have an assistive device that we'd like you to learn how to use, and we'll go ahead and go over that today. I have a video. It is a walker, and so I'm sure you've seen them before, but we want to make sure you properly know how to use them. So I'll go ahead and step out real quick. I'll grab a video that you can watch that'll show you how to use it, and then we can have you demonstrate to make sure that you picked up on that learning, okay?
Okay.
Okay. Okay. Osteoporosis, we do typically tend to see that kyphosis, where those shoulders start to round out, and you see it in your posture. So I really hope today's appointment was helpful for you, understanding what osteoporosis is and how to, further prevent the progression. Hopefully I answered all of your questions. I'm going to go grab the doctor so they can review everything with you, and I really hope the best for you and wish you the best of luck, and don't forget that we are here in case you ever need us. Hi, nice to meet you.
Thank you so much.
Nice to meet you.
Bye.
Thank you.
Thank you again, Ms. Smith, for coming in on such late notice. Did the nurse go over everything with you today and answer your questions?
She did. She provided us with movies to watch, to demonstrate what exercises to do. She gave us pamphlets and did some
Good.
wonderful teaching. So she did a great job. And then I was able to demonstrate to her how to do those exercises, which really helped me to reinforce everything.
Good.
So it was wonderful.
And she answered all of our questions, and I feel really confident about my mom being able to take care of herself when she's at home.
Well, good. That's what we want to hear, okay? Well, thank you again, and good luck to you guys, and you call us if you need anything.
Okay, thank
Thank
you. for
you.
everything.